We've come to talk to you about how we've done it. So we're not a pathfinder, but we've had lots of support around how we can implement and start to pilot family help in Blackburn with Darwen as part of the social care reforms. We started way back in September 2023. Tracy Licence, who's our service lead / acting head of service around family support, together with Zoe, ran lots of consultation sessions with our partners, and that was key. First off, we developed our family help strategy alongside partners from the health economy, the police, the voluntary sector, education. Everybody was firstly part of developing that family help strategy. We wanted to develop a Blackburn with Darwen specific approach for that timely support. We were really keen from the outset that this would be around testing a new model, test and learn. And some people in Blackburn with Darwen are getting sick of hearing the test and learn, but that's what we're in, that's what we're doing, and that's what we're going to continue to do for over the next 12 months. Promoting a families first culture, strong family network involvement. That is the key principle, isn't it? Being out there in the families, in the communities, and we'll talk about how we manage to do that as well and continue to. Using systemic principles in practice, whole family systems approach, first and foremost, keeping children central, making sure we're listening to them, we're responding to them as the key part of that. Align with local services like family hubs. Fortunately, prior to this, we did have our family hubs embedded. We've got 4 across Blackburn with Darwen, with some spoke children's centres still in place as well. So really fortunate we've been able to keep all of that offer. Ensuring teams understand thresholds, risk and harm, and that's not just social work teams, that's partners, that was our early help teams, that was education, the police. So really bringing those partnerships together to understand those thresholds from the outset. MASH maintains oversight on thresholds, so MASH is still that decision-making forum, but really keen that actually anything that doesn't meet that safeguarding threshold, don't really like that word on Sal's page, around that, but we used to talk about having one front door. Well, we don't. We've got all our family hubs, and that's where we would want families to go to first. But for those higher level families where it is meeting that safeguarding concern, obviously our MASH is still there, linked to our localities. We have our MASH practitioners now, our social workers and team managers going out to our family hubs weekly. They are part of our family hub meetings, which Michaela's going to talk about. So we're seeing that journey of children from MASH right the way through. So some of those practitioners that deal with those families in MASH are able to see the trajectory, know what's available in the family hubs, and we take that golden thread through. Family help social workers receive quality supervision from social work managers. We'll touch on what the supervision looks like within our family help teams. We are moving away and actually giving those family help workers and family help team leaders and family help managers more autonomy around supervision. But we're really keen from the outset that we had those checks and balances in place from social work oversight to make sure that we were assured that we were following the right pathways, that children were sitting in the right part of the service and were receiving the right offer. And always from the outset, we've swooped social workers in if children are open to family help lead practitioners, that risk has started to escalate, or we've started to become more worried about that risk.